You're listening to Health Coach Conversations, a podcast where our conversations help health coaches all around the world to level up our businesses and to get more clients. Hello and welcome. I am Kathy Sikora, founder of the Health Coach Group and host of Health Coach Conversations. I am here today with Dr. Richard Safir. He is a highly respected leader in the employee health and well-being field. His work is featured by the Center for Disease Control and Prevention, and he's been quoted in the Wall Street Journal, the Washington Post, and Fortune magazine. Dr. Safir currently serves as the Chief Medical Director of Employee Health and Wellbeing for Johns Hopkins Medicine, where he leads the Healthy at Hopkins Employee Health and Wellbeing Strategy. He's also the author of A Cure for the Common Company, a well-being prescription for a happier, healthier, and more resilient workforce. Dr. Safir is board certified in 3 medical specialties, a fellow in 3 medical colleges, and has been recognized by a former Maryland governor for his contribution to the state public health system. I'm excited about our topic.
Good. Thank you for the invitation. I have had a lot of experience on podcasts, but I saw that my pipeline was maybe not as robust this summer. So that's why I started looking. And I've worked with health coaches for quite a number of years. And I'm pretty excited because I think it's really important that health coaches kind of put themselves in their clients' shoes during the workday. And that's what I hope to achieve today.
Oh, good. Good. Yeah. Well, we've spent some time researching. As a matter of fact, it's been a while now, but I paid somebody to research the corporate wellness field. And I would think that you would be the king of that. You would know exactly what's needed. What I determined from all of that was that you have to talk to human resources because every corporation has their own needs, right?
Most corporations place this kind of work in HR, and most HR people are not trained, educated in this area.
So that isn't where we should go to find out. Should we be telling HR what they need?
It might be difficult for any individual to be able to get the attention of a human resource professional at a large company, but possibly at a medium-sized company or a small company. That is true. I don't know the health coaching industry like you do, Kathy, but I'm guessing that, well, you tell me, what % of coaching clients do you think are coming to health coaches as individuals versus an employer asking for coaching services as a benefit? Do you have an idea?
I don't know that number. If I were to guess, which I could just as easily be wrong as right, I would think that probably fewer are coming through their employers than are coming individually, or through maybe doctor referrals or insurance referrals. I know that a lot of insurance companies now.
So most of the people who are getting helped by health coaches are really being seen as an individual who's got a health challenge, which is completely understandable. Now, if health coach training is anything like medical school training, then most of the health coaches are not getting exposed to this idea about how do we address the 8 or 9 hours a day that our clients or our patients are spending working, either remotely or in the workplace. We spend most of our waking hours working. So it is in our best interest, if we're really trying to optimize the help we can provide, to understand how the workplace and the workplace culture impacts our ability to make healthy choices and have a positive mindset day.
While you're talking, I'm thinking about something else. I've been going to physical therapy, And do you think that mindset's the most important thing, or do you think sitting around at your desk for long periods of time is a big part of it too?
I'm always reluctant to say what's most important for two reasons. One, I think everything's related. I think it's inescapable to show the connections between how getting up from our desk improves our mental health and how improved mental health helps us get up from our desk. And the
Right.
second reason why I'm always reluctant to kind of give a ranking or what's important is that everyone's individual. And for someone who has no problems exercising or standing while working, who has terrible anxiety, I think the answer might be pretty clear. But
Mhm.
that person already has the benefit of having established exercise and movement as part of their healthy habits.
Right, plus they've also established having a problem that they can
Yes,
focus on too.
right, they
Yeah.
know that they have a problem. Now, that person, though, may not fully appreciate what it is about their job. So, first of all, what is the cause of their stress? Many people can identify as work as part of their stress.
Mhm.
However, I'm not sure how often people are asked to pursue the details behind that. Like, what is it about work that is stressful? And then once you can find the top two or three reasons, then trying to create strategies to keep those stressful prompts from happening. And prompts doesn't just mean like a specific work or a specific time of day, a specific meeting. It could also mean people, the people we work with. It really, I think, is worth exploring with clients slash patients.
Right.
Tell
So,
me. Yeah,
emotional intelligence would come into that, maybe some practice with that.
absolutely. I mean, boy, having emotional intelligence is a gift. I imagine, though, the clients who come to health coaches have a lot of needs. So we might have to help them with some prompts.
So
They
asking questions is important for health coaches.
Oh, without a doubt, without a doubt. And having a repertoire of work-related questions that impact health and well-being, I think is vitally important because of, again, the number of hours most Americans spend working and in the workplace.
Your area of expertise is shaping the workplace culture to support employee health and well-being. What is workplace culture?
So, culture itself is the shared behaviors, beliefs, and attitudes of a group of people that has something in common. So, workplace culture is that the group of people all work for the same company or organization. Cultures can be defined by geographic location, they can be defined by sports teams, they can be defined by religions. There's lots of different ways, but every workplace has its own culture. And even within a workplace, there can be subcultures. So these would be the cultures that are specific to certain teams or professions in a culture. You pick an industry, and we can talk about what kind of subcultures can make up that overall culture.
You want me to pick an industry?
Sure, sure. It's like we're picking out of the virtual hat today.
Do you know what? Let's pick. Can we pick? Well, and I don't know if we consider that an industry, but what about churches? Uh,
Okay.
would it be
So
safer to pick maybe Godfather's Pizza?
sure, we could pick Godfather's Pizza. That's
Okay.
one I didn't expect. Um, but we could also stay with your first instinct, which
The
was
church.
the church.
Yeah.
So you have clergy. So
Mhm.
the church has its own culture, but then you have clergy, and they have a culture, a professional culture. Their culture is defined by a shared profession within the church. And then you have laypersons who support the functioning of the church, and they have their own culture. And then you have churchgoers or the congregation, and they too have a subculture. And so even though they share the broader culture, there are some nuances. And so in the workplace, the same exists. I mean, Johns Hopkins Medicine, as you realize, is a huge health system. And there's a culture within across the organization, but the doctors have a culture, the nurses have a culture, the accounting department has a culture. And those cultures probably, those cultures are the nuanced or more detailed aspect of the organization culture. And those people that we spend most of our day with, our team members, they're going to have a much bigger daily impact on us.
Struggling to create content? The Health Coach Group offers top-tier done-for-you wellness courses. Save time and focus on what you do best, coaching. Explore our courses at thehealthcoachgroup.com.
Well, yeah, if we use the hospital example, you've got people that are in the emergency room that are high stress all the time. And then maybe you have people in the X-ray department that maybe they have some stress, but it's not like
Right.
what you have in the
That's right.
emergency
And it's
room.
different kinds of stress. And I think that's a great example if we could stay with that. And if you're a health coach and you ask your client, what do you do? I'm in healthcare. And then you don't pursue that, you may not get to the point of discovering one of the solutions that they don't realize could be very beneficial. If you work in the ER, and part of the stress is the pace. And not only is it the pace, but it's how fast your mind's working and trying to keep things on task. And even when you get a break, it's really hard to help your mind slow down enough to give your mind a real break during those, let's say, 15 minutes. So even though you might be physically resting, your mind might not be resting in those 15 minutes. And then by the end of the day, you're absolutely exhausted, both physically and mentally. And so trying to understand the cause of the stress is the first step in getting to some solutions.
You could have one person in the group that throws everything off. And then I would imagine that each of the subcultures would have similar issues sometimes, but then maybe totally different ways of handling it, right?
Yeah. Right. So our peers, our coworkers can either support or harm certain healthy habits or whatever mental health we're trying to achieve. And they more often are probably inadvertent. I don't think most people go into the workday thinking, I'm going to stress someone out today.
Yeah.
But
Some people do, but not very
maybe.
many.
But perhaps it's a matter of knowing how the person next to you makes you feel. I mean, I think that is like even that is valuable. Just pausing long enough to say, you know what? When I see Joe, I always feel like a little bit jumpy. And when I see Pam, I always feel a little more calm. You know what? That's probably not my imagination. And so if I want to feel more calm during the day, I need to hang out with Pam more. And if I'm like already jumpy, maybe I don't hang out with Joe. Or if I'm tired that day, maybe I do hang out with Joe because I need some of Joe's energy.
Right. Okay. So when I look at ways to help health coaches figure out how they can help with different situations,
Hmm.
I look at lifestyle changes.
Sure.
Are there different lifestyle changes that, or transformations, or lifestyle management? Is there a way to manage lifestyle in these kinds of situations that would make it easier for a health coach to work with people?
Absolutely. So, Kathy, I was part of the American College of Lifestyle Medicine before it was a college. So, I've been involved with it for over 20 years and I served on the board of directors. So, I'm absolutely supportive of lifestyle medicine as a profession and lifestyle as medicine for everyone, including myself. And if we're going to spend most of our waking hours working, we can't ignore our job and our workplace as part of our ability to make those healthy choices throughout the day. And some of the challenge is environmental cues, and some of the challenge is the people we work with. So, Kathy, I'm a chocoholic. I'm recovering. I'm doing pretty well. Last weekend, I had a handful of chocolate peanut M&Ms at the prompting of a sibling I was visiting. I hadn't had like sugar candy like hard up in a while. I felt terrible later that evening, and I knew it was because my body hadn't been exposed to sugar much. I was in our workplace earlier today, and a nice woman who works on the same floor with me, she always has a bowl of chocolate on the desk behind her. And whenever I greet her, she offers me a piece of chocolate. And today I said, you know what? I'm going to pass. Now, more often than not, I don't pass and I have a piece of chocolate, but I remembered how poorly I felt.
Mhm.
Now, my colleague has good intentions, but if she hadn't prompted me, I wouldn't have had to make that choice, right? So somebody else who wasn't thinking about chocolate, who walks by and says hi, all of a sudden they have to make that decision. And based on their previous experience, if they like chocolate, there's a good chance they're going to eat it. So our coworkers can absolutely impact our lifestyle.
We've got programs. We create wellness courses for health coaches and doctors and nurses to work with and insurance companies to work with their patients or their customers. And we have one on healthy home. We have one on stress and sleep and nutrition. We don't have a single one on how to make your workplace healthy. That would be a good program to have.
I'm thinking so. I'm thinking so. Most American adults are working.
Yeah.
So if we have to make it part of the solution.
Yeah, I remember when I was young, well, it was an interesting job, but it was a factory where a lot of people in the factory were eating Asian food
Hmm.
and they all brought the same thing for lunch. So there you've got an extreme example of culture,
Yeah,
where yeah.
that's exactly right. The food is a big part of our day. We need it, and it absolutely impacts our health and well-being. And there are many things that impact what we eat. So we talked about coworkers, but what about our manager? If our manager is supportive and calming and reassuring and praises our work, then hey, there's a good chance we'll be able to go to the gym after work because we'll be in this good mood. And if our manager is the opposite, always criticizes, never tells us what we did right, everything is urgent, we don't feel heard. Well, that could be the difference that makes it so that we go home and sit on the sofa and eat a bag of potato chips.
Yeah, I've
How
seen
we convert our stress level after work
yeah.
is highly dependent on the stress we experience or not at work.
Yeah, and you know what, you can pick all that up too. I can remember another place where the president of the company he had a bar in his office, you know, so everybody would start drinking at noon.
Oh my goodness. Oh my goodness.
Can you imagine how their lives went?
No, if we have to bring the alcohol to work to get through the workday, that's a problem.
I'll bet there's a lot of places like that too. You see that in all the shows in the 50s, where
You,
they're
I always
handing
kind of
out.
wondered about, people go out for lunch and they have a drink. I don't know if I'm old fashioned or this still happens. I just was not of that mindset.
I can't imagine being able to get anything done past
Yeah,
noon.
yeah, yeah.
That would be a culture of non-productivity.
Mm.
Your success is our blueprint. The Health Coach Group empowers health professionals with the tools and strategies needed to attract clients and build a robust online presence. Take the leap to a successful practice with our support. Visit thehealthcoachgroup.com now.
What are norms and how do they impact our healthy habits?
So well, Kathy, I created a model for how to build a well-being culture in the workplace. And I did that initially to help myself get my head around what's shaping culture. But then I started sharing it with the external community. So this model's in papers, it's in my book, and I've already listed 2 of the 6 building blocks: peer support and leadership engagement. Norms is a third. Norms are the expected and accepted behavior of a group of people. So, for example, in the hospital, it's expected that nurses and doctors wash their hands before they go see a patient and then afterward. Not only is it expected, but it's accepted. And most workplaces don't accept drinking during the workday. So
Right.
there's a norm, no drinking. And so when we're at work, there are norms all around us that influence us. Now, if you are in a workplace and everybody stops at 12 o'clock and gets up from their desk and they go to a lunchroom and they eat lunch together, there's a good chance that you are going to get up and go eat lunch with them. It gives you a break, which is good for your brain, and it helps improve your social connectedness, which is also good for your well-being. The opposite norm could be true, whereas everybody on the team is sitting at their desk, working through lunch, eating while on their computer or on a meeting. And if you're the one person who wants to take that break, you may be pressured to not do that because you don't want the boss to think that you're not doing your work. And there's a norm that's working against your health and well-being. It's helpful for individuals to think about their health and well-being challenges and think about their workday. Are there any norms that are going on their team or in their organization that are working against them? And if there are, what are you going to do to get around that? Because just because everybody's doing one thing doesn't mean that you should do that one thing if it's not good for your health and well-being. But that takes a lot of effort.
Who would you go to for help with that?
For the identification of the problem, I would speak to a health coach. Maybe they can help you figure that out. To create solutions, I would do what you do with most other challenges, and that is talk to family and friends and brainstorm. If you think that going against the norm is going to create a problem, that may either be true or just your perception. Either way, have a conversation with someone at work to test the waters. Ask that coworker, what do you think the boss is going to say if you and I take lunch together today? You may be making stuff up in your head. Maybe it's not as big a deal as you think. If you're still not comfortable, maybe you ask HR, hey, is it my imagination or I thought we get a half-hour lunch break? It might just take some reassurance. And if hopefully people have a good enough relationship with their boss, maybe it's just that, hey, I'm taking a break at noon. Do you need anything before I go to lunch? Just checking in so that you don't feel odd about breaking the norm.
What can a boss do to help?
Well, a good boss, an enlightened boss, would be leading by example. That boss would not only be taking lunch, but making it known to their team that they're taking lunch. The boss works all day with the door closed, and they eat lunch in there, not on their computer, but reading a relaxing pleasure book. The team doesn't see it. They don't know. So the boss needs to set that example, be a visible role model, literally invite people. Hey, what are people doing for lunch today? There's a lot that a manager can do. Kathy, I've been in this employee health and well-being space for almost 30 years. It was barely a space when I started. And we you mentioned previously that you have training programs in different areas, but not health in the workplace. And I mentioned previously that, most HR leaders aren't trained or educated in employee health and well-being. There are a lot of reasons, in addition to those two, that I wrote a book, A Cure for the Common Company, so that managers, HR professionals, health coaches, people in the employee health and well-being space could understand not only what's happening in the workplace that's influencing their health and well-being, but actually give them practical solutions to make sure that the workplace culture is working for them and not against them.
Can you set an ideal model, or is that hard because there are so many different cultures?
Well, different industries, have different nuances. Even within the same industry, there's different nuances. But there is a model, Kathy. There is a framework that, when followed, yeah, it creates much better circumstances and situations that makes it easier to be healthy and happy throughout the day. Those are those six well-being culture building blocks that I previously mentioned.
I brought my kids up. The best thing you could do is teach them to be hard workers. And my son moved to England and started work, and they laughed at him the first day because he got there 2 hours earlier than everybody else.
Yeah. Well, it's interesting because there's an American culture, and it's
Mhm.
the hard work ethic. And that goes back, 150 plus years to the American work ethic. That is a culture in itself. Now, we all know that maybe Americans go too far. And because of that mindset, that value, that that can have detrimental effects on our health and well being.
Yeah. Yeah, they have lunch that is required, and then they aren't allowed to work past, well, unless they've got a project coming up. I guess everybody has their allowance for extra work depending on what the output needs to be.
Sure.
Yeah, that's interesting. Yeah, the different places in Europe have nap times.
Yeah. Yeah. Yeah, I mean, and some, cultures like Spain, it's part of the culture. And so it's been integrated into the workplace culture.
Right. And we shouldn't keep it a secret if we sneak out for an hour every day to go swimming or to do something recreational.
Some workplaces can accommodate that. You can't have nurses leaving the hospital for an hour to go swimming, right? And
That's
and
right.
this is the thing about occupations and workplaces, that they're all different. And this is one of the really special and valuable ways health coaches can help their clients, is by exploring how their clients spend most of their waking hours, which is most likely going to be related to working.
What environmental cues can make it easier for the client to stick with their healthy goals?
So I mentioned previously, just this morning, I passed my colleague's office who had a candy bowl on her desk. Now, she's certainly welcome to have that candy bowl on her desk. The employer would make it life easier for me if they didn't put chocolate in their vending machine all over the place. And in fact, at Johns Hopkins Hospital, the vending machines are 80 to 90% healthy choices, so that people who want to live a healthy lifestyle have many more opportunities to do that. So that's an environmental cue that has to do with nutrition. An environmental cue that has to do with physical activity would be having a sign near the elevator that says, take the stairs with an arrow pointing to where the stairwell is. Now, there are, dozens of things an employer can do. However, assuming, we don't have too many decision makers at the top of the organization on this listening to our podcast today, Kathy, let's say that most of the people listening to our podcast today are not making facility choices. We as individuals can be giving ourselves cues to meet the goals that we're seeking throughout the day. We can turn off the notifications on our email, any internal chat boxes, we can turn them off, because let's say one of our personal goals is to lower our stress. Well, guess what? All those beeps, buzzers, and bells, those are stressful. They interrupt our train of thought. Then we have to start over again and we lose time. We can control many of the environmental cues throughout our day. And, we can get into whatever lifestyle goal someone's trying to address. But to be aware that unless we are specifically making plans, we're missing a huge opportunity. I'll just do one more. We really want to exercise. The night before, we should be thinking about what are we going to do for exercise the next day, and how does this impact my work day? Do I need to make sure I have sneakers in my bag for work tomorrow? Do I need to make sure I have my whole gym bag packed? If I'm at work, how am I going to get movement throughout the day? Because it's not okay just to go 8 hours and to go straight to the gym afterwards. That's 8 hours of sitting. So what can I do to make it so? Are there any meetings that I have tomorrow that I can do standing up? Are there any meetings tomorrow that I can do walking with the person I'm meeting with? Look at your calendar the night before. Make plans, because otherwise we're not treating ourselves as best possible.
Well, we're all going to have to get the book, A Cure for the Common Company, right?
I think so. I mean, there's very few books that are designed to help people with their health and well-being when it comes to the workplace. And that was a huge reason why I wrote the book. And I do believe that it will help your audience, both as individuals for their own health and well-being, as well as coaches and people in the coaching industry who are trying to help others. This is critical. We can't ignore the workplace and jobs. Otherwise, we're really not doing our best.
It's a huge part of the day.
Yeah, I have a certified health coach on our team.
Good.
I've got 3 people who are certified health education specialists on our team. I have a colleague who lives in Arkansas. I live in Maryland. She used the book to coach a group of 6 executives, both for their own well-being as it relates to work and for how, and they built a strategy based off of the book and their discussions. So I think that you are in the right community to really expand the thinking so that we just don't live in vacuums. There's too much going on during the day.
Well, and nobody thinks about that. Nobody, well, who wants to think about while you're working? You wanna work so you can get off and do your other stuff.
I have a question for you.
Okay.
It's about this idea of helping. You mentioned you already have a couple of courses, and this idea about a course to think about to help your audience with this workplace. If you haven't read my book already, can I send you a copy of it?
That'd be great. Yeah,
Okay.
and I do think that it'd be a great book. And usually things that pop up like this it's something that every single health coach can work with. I don't think that they have to worry about going outside their scope of practice with this. So that's good too. Go
I
ahead.
should have asked. Yes, and if there's some collaboration that you think is warranted, let me know. I am going to stay employed for some time. The book's been fun and it's successful, but it is not my retirement plan because it won't fund my retirement. But maybe it's a runway.
Good.
All right.
Cool.
Thank you
Thank
so
you.
much.
Thanks for listening to the show. If you liked what you heard, please give us a 5-star rating or review on iTunes.